email us, or connect with us on social media.
Fun, casual, intimate, and personal chats with artists and creative folks in the LGBTQ plus community and friends, all on Season 7 of On the Couch.
With NHL Center Ice, you get a premium ticket to the games you want every night of the season. Catch every key out-of-market matchup each week. You'll get more goals, more saves, more non-stop action from the teams you love. NHL Center Ice, part of the Rogers Super Sports Pack. All this for only $35.95 a month. Order through your remote on Channel 450 or call 1-888-ROGERS-1 today.
You're watching Rogers TV, Grey County.
Hello and welcome to the special edition COVID-19 Rogers TV program. I'm Carol Merton, and before I welcome our guest, I want to share a few thoughts with you. On Thursday, January 14th of this year, 2021, as part of the declaration of the second provincial emergency, a stay-at-home order was issued. This order and other new and existing public health restrictions are aimed at limiting people's mobility and reducing the number of daily contacts with those outside an immediate household. We are all now on the front line. We are all working together to stop this virus and the variants from spreading. This virus will seek every opportunity it can find to spread by finding loopholes. Let's not give it that chance. This is hard work for all of us. It is hard to be isolated and have our daily routines disrupted. We are all weary. Essential workers in healthcare, long-term care and retirement homes, public health, first responders, pharmacies, our local businesses, and all of the support service agencies, along with others, so many others, need our support now more than ever as we move through this time together. On the horizon, there is hope that a future vaccine availability will allow for us to move back to our more normal living. We have to go through the various levels of prioritizing who gets the vaccine first. But we know all those who choose to be vaccinated will eventually be given that opportunity. Never underestimate the value and importance of what we are doing by following the Public Health Unit guidelines. The sacrifices that we make each and every day are helping to prevent the spread of COVID-19. We are saving lives. I want to thank you for what you are doing as a community in preventing the spread of COVID-19, and let's continue to do so. Now, on that note, I also want to thank our guest, Jackie Ralph, who's joining us today. Jackie has been on our program before, and I always enjoy speaking to her because she brings additional information each and every time. Jackie is the Youth Awareness and Education Supervisor for the Canadian Mental Health Association, Grey Bruce. Have I got that right, Jackie?
You got it.
And today, I think the topic we're going to be chatting about is coping with the stresses of COVID-19, especially in this second wave, and any strategies. So Jackie, I'm going to be listening with open ears because I will absolutely say it's getting really tough, this isolation and lack of social contact. So I'm going to be really listening for strategies as well. So thank you for being on the program. And where would you like to go first with the conversation?
Well, it's funny to hear you talk about the different waves, because I know it's funny when none of us have been here before, right? None of us were around in 1918 when all of this was first going down, right? So everything's new to all of us. And I remember reading way back when they talk about a second wave and a third wave, and I'm like, I don't understand what they're talking about. Once we all stay home, it'll all be gone and it'll be good. So so I think that in itself is a big part of it. We just didn't know that this kind of thing was possible, or what it would look like, or what it would feel like. And then we think of, all the folks doing so many different jobs, right? We got parents who are teachers, never wanted to be a teacher. We have, our essential workers that we think of folks that we never thought of essential workers before. And all of a sudden it's like, oh my gosh, like when I go to the grocery store, I'm so thankful. I'm like, thank you for you, and thank you for everything you're doing. And I know too that I always pull back to a quote from Brene Brown. I love Brene Brown. And she said, when we're in a place of fear, we sometimes respond in our best selves, and we sometimes respond in our worst selves, but it's still a response of this fear that we have. And what I was trying to say was recognizing that not everybody is used to responding in fear. So whatever they do in a response is just where they are. And boy, has it really brought a lot of conversations around, just giving people that space and not reacting in your worst self back, and doing your best to respond in your best self, even if I'm responding in their worst self. So I really appreciated that. And I can't help but think of, there was a quote early on about the pandemic. We have to look at the pandemic like a marathon and not a sprint. And I thought what they meant to say was it's a marathon of sprint every day. And that's what it feels like sometimes. So
Yeah, I hear you for sure. I used to say we're all a little crispy, but now I have a new phrase, and it's COVID cranky. We get so that the tolerance isn't quite the same sometimes and I know you're going to talk about maybe some of the differences, but in the first wave, we were hoping it would be short term. We were all in it together. We all kind of shared the experience. Now we're in the second wave, and it's like, okay, this is hard. It's taking a long time. And I find that just a little bit around the edges, a little quicker to respond in maybe not as positive a way. Are you finding that as well?
Yeah, because when you think about it, we had gotten to this place where we were used to things happening, like, hey, Google, look up so-and-so for me, right? And instantly it was done. And that's kind of how we got used to things, that things were instant. And absolutely my package arrived instantly, and but this doesn't change instantly. And so I think it's tough when we're used to things happening right away, but something like this is taking a little longer. And it's definitely been a practice on getting used to those timelines.
For sure. Yeah. So what's your advice around, from your perspective? Now we're in the second wave, and we know the vaccine is coming, but it's, again, not coming as quickly as we had hoped. What can you suggest for coping strategies for people?
Yeah. And, we can never say it enough. You really got to focus on those basics, right? Go back to your basics. And, are you getting enough sleep? Are you getting enough to eat? Are you eating when you're hungry? Are you staying connected to people? That, oh my gosh, it is so important. Even if that means sending a letter, popping it in the mailbox, if it means, phoning a friend when you need to chat, but really focusing on those basics. And again, to steal from Brene Brown, she says, making a list of the things you can control and then controlling the crap out of them, right? So, and I so appreciate there's so much I can't control. And it's so easy for my brain to focus on those things, but gosh, we got to reel it back in and focus on those things I can control. I can stay on my regular schedule. I can still get up at the same time of day. I can still do the same things I did in the morning. Those are things I can control. And the more we do that, the more it feels like, oh, okay, look what I did. I stayed on that schedule. I achieved all those things that were on my to-do list today. And then we have something to celebrate at the end of the day, instead of something to, oh, I missed that, I didn't get to do that, because boy, we can get stuck in there. We did a video Wednesday for the kids, and we said, Groundhog Day is an interesting time of year, because thanks to Bill Murray, we now look at Groundhog Day like a loop that we can't stop. And boy, can our brain get into loops we can't stop. So Groundhog Day becomes this unique day to go, okay, I'm starting a new loop, right? Let me start a positive loop, and let me kind of throw out that stuff that's been weighing me down, and start adding on a daily basis some positive stuff. And what a difference that makes.
And so what I'm hearing you say is, first of all, seek the normal in an abnormal situation. Control what you can in your daily life, because then you will still accomplish what is normal for you.
You got
Even though we're surrounded by all sorts of abnormal situations, like you say, 1918 was the last time, right? So seeking that, feeling good about the accomplishments as well, I think, because I think it's easy to get, well, I can't go shopping and I can't go to whatever. You get into that loop. What would you say to people when their mind starts to go, well, I can't do this and I can't do that, and what can I do anyway?
Well, we got social media, use it for good, right? What I love is I've been looking up lists of things to do at home, right? And checklists, right? Now's a great time to learn that instrument that's literally at the back of my closet since, the first summer folk, when I thought it'd be great to play guitar. And then it's still there. Oh, I get out. This is a great time to do that. Or, I always thought, I live in Canada and my French is terrible. It's terrible. Well, it's a great time to, get my French back to where it used to be in high school. All those kinds of things. Again, and all, workout videos. There's so many yoga videos on YouTube, or I think of all those folks in our community. We just did a yoga video session on Bell Let's Talk Day with the amazing Shannon Crowder out of Hanover, and she does yoga on you. You just click on and you do it with her, and you can chat with her and interact with her, and it's yoga for people who aren't experts at yoga. Like, there's just so many great things like that. Gosh, you can watch the pandas if you want. Turn on the panda channel, watch the pandas at the zoo. Like, how does roly poly pandas not make you smile? Like, yeah.
That actually makes me smile just even to think about it. Never mind to talk about it or to watch it. So for those people who are, sometimes when people get heavy, when their mood gets heavy, it's a little tough to get that spark. And sometimes it affects sleep. Any thoughts when people are saying, oh, again, I just don't know, because I'm finding people are getting de-energized.
Yes. Yeah. You got it. We always talk about, in mental health first aid, we talk about our stool, right? Our three-legged stool. And in there is sleep and exercise and food, right? That when we get enough sleep, we have enough energy. And when we have enough energy, our focus is good. And when our focus is good, we can stick to a schedule. We can pre-plan our meals. We can book pack a healthy lunch. And when we do that, we feel good at the end of the day, and we have more energy to take a walk. And when we take a walk, we're more likely to sleep better. And then when we sleep better, so it becomes a circle that works in our benefit. But again, because it's stool, we think of it like a three-legged stool. If our sleep's off, well, it throws the whole thing. And honest to gosh, that sleep is the biggest basic that we need, because we can 100% we can sleep too much, and 100% we can sleep not enough. And it's about finding that sweet spot for you where you still have that energy. And there's so many great, again, tools to help with that sleep. Again, you sleep better when you're tired, and you're tired after you move your body, right? And you sleep better if you haven't had a heavy meal right before bed. You sleep better if you've got distractions out of your bedroom. Again, there's so many, our Bounce Back program that is available to all CMHAs across Canada now. It even has a book specifically, a workbook specifically on helping you sleep better, because it's so important. And it's such a basic that everybody deserves. There's no other way to put it. Everybody deserves rest.
Yeah. I found it interesting. You mentioned that it's actually a mental health first aid.
Yes.
And that's an amazing way to think about it, So when we're facing challenging times, just like if we had an injury, we go to first aid, right? We go to get a Band-Aid or whatever. So you're basically saying that the first aid kit or emergency kit for us is self-care.
Yes.
Self-care.
And isn't it funny? We used to say, the self-care if I have time for it, right? Or, and we remind ourselves it's not selfish to take a moment for self-care. We used to say that too. Well, you know what? I think we've passed that bus. That bus is passed now. And we recognize that self-care is a priority and needs to happen every day. And so if there's anything I'm thankful for in all of this, it's really pushing that message out that self-care needs to be part of your routine, not just something I'm going to do on Friday night to I got through that week. It needs to be every day. And that's going to be the toolbox to get us through this.
For sure. It's almost a survival strategy right now, self-care, and that it is actually the first step to being able to move forward. And I'm not sure I would have thought of it that way until just the way you explained it. I think it basically giving yourself permission to go back to the basics, to take care of yourself so that you've got the resources to last the marathon of many sprints.
Yes, exactly. And again, if I've done all these things, Jackie says I need to do self-care, and Jackie says I need to have good sleep, and Jackie says I need to think positive, and I've done all those things, and I still can't seem to get out of this feeling, this funk I'm feeling, or this negativity I'm feeling, or I just can't get out of my head. Please know that there is so many solutions out there, and options, and people and services and organizations. I always look at help kind of like a layer. We have the stuff that we can do ourselves, like the Bounce Back program that I can do from my home, the helplines that I can call from my home, the prioritizing and making myself a schedule and a checklist for my self-care. Those are things I can do myself from home. But then there's the more structured supports. Is it time for me to call this CMHA place you guys talk about all the time and get myself a counselor, or connect to the peer support program, or go to one of these mental health first aid courses, or join the wellness recovery program, the more structured supports. And then we always know there's that, what we call acute care, the do not pass go, do not collect $200. Now is a really good time to call for some support. So we have our urgent response team that are in partnership with our local police services. We have the crisis room up at the hospital, where you have access to on-call psychiatrists and social workers. The rapid addiction access medicine clinic is there. So we have all these folks that are at the waiting. I use Kids Help Phone as an example. So we're kind of in between, right? So we know calls have gone up. Just looking at Kids Help Phone, in 2019, they had 1.9 million calls to Kids Help Phone. In 2020, they had 4 million. So it more than doubled.
Goodness.
Oh my goodness, it's right. And you look at that and you go, that's more people, but 4 million calls were answered. That's the only way to log that. So that means they increase capacity. And that's something to celebrate. 2020 was the first time the Kids Health Phone received federal funding. It had always existed purely on donations. That's amazing. 80 more counselors were hired with that funding, and that's across the board. So our distress centers have got more funding. Our hospitals have more funding. We got more funding, and as a result, we're building capacity to meet those needs and meet those calls.
And basically, that's people who are needing help, who are reaching out, who are absolutely reaching out. Let's say I wasn't familiar in the community or didn't have the numbers handy. Is there one number I should call?
Oh, yes, there is, Carol. I always love when you ask me that question. So if my house is on fire, I don't even think about it. I call 911. It's not even, it just happens. If I need to know what's available in my community, I call 211. It's just an automatic. Because otherwise, Carol, we would need 45 minutes to go through every service we have available in our community. Well, you know what? Call 211. They have all the same information. They have an updated list. And the really great thing about making that call is that maybe I call about one thing that's kind of weighing on my mind, and they hear my questions and have my conversation and go, well, did you know this existed? Oh my gosh, I didn't even know it was a thing. Now I have even more resources that maybe I can start using.
Yeah, and that's really important. You mentioned about the 45 minutes, and when you're feeling overwhelmed or things are just too much, just having one call, I think is really a key. And even if you're not sure if you need help, if you just make the call, then at least someone is there to say, well, have you thought about this or the other options? It's a confidential line, right? People don't have to be concerned.
Yes, and I always say the really great thing is because our local 211 office, the folks that answer the call are out of Collingwood, they know the difference between Durham, the town, and Durham, the region. And that's important for folks in Grey Bruce to know. They know where Dobbington is. They've heard of Desborough. And that's, I think, really important for folks to realize that they're going to know where you are and they're going to be able to give you the right information.
From your perspective, from the first wave till now, any surprises for you? Anything you didn't expect? What are you seeing and what are you hearing from people?
Yeah, and I know, again, I just go back to the stats of Kids Health Phone and the increase in folks who have been feeling that isolation and grief. Grief has all of a sudden become a topic. But at the same time, what's really that I pulled out of this is there was always this belief that this kind of thing couldn't happen in the mental health world, that we would never be able to provide this kind of, that this kind of service was tricky to provide on Zoom. But it's amazing how people have embraced it from both ends. That we quickly pivoted and turned our counseling and supports and services to virtual. And for many people, it works so much better. It takes away transportation. I don't have gas in my car this week. I can't get that shift off work to get downtown between 9 and 3. So I think out of all of that, it's just been amazing to see how the organization and the mental health system has changed to really meet where people need to be.
Are you anticipating when we have conquered COVID, that this kind of model of possibly remote versus in-person will continue?
Yes, I would very much think that, and that's really exciting to think that there's going to be options. So a really wise person told me once that there's no such thing as duplication, there's options. And when there's different options available, we're more likely to reach out for those options and find the right fit, because it really is about fit. You may not connect with that first person. I always say, if I meet a counselor who doesn't like karaoke or coffee, this isn't going to work. right? This is, we're just not going to find some common ground. But
Yeah.
So it's about finding that option that works for you in terms of format, timing. Yeah. And this is really going to be something I think we carry forward.
It's almost like a menu where people have choices around what fits with their lifestyle and their needs, rather than just one particular avenue or resource. What would you like to share about the most important things at this stage in COVID, recognizing we may be a few more months, and probably will be, before we can start to even get the flavor of life together again without technology?
And I think it's reminding ourselves we made it this far. Look how far we got, right? You think it was a year ago that almost a year ago we went into lockdown, but for sure a year ago that we had the first patient zero in Canada. And that's incredible to think we did it. Like, look how far we've made it, and what we've learned. And it just makes me so grateful to know that so many people didn't even hesitate, and they responded, and they just stepped up. And I see that every day in people and how they have learned a new technology. Gosh almighty, Carol, I was so excited I got your call on Skype in the first clip. It took me a year to do that. So that's something I'm so excited about, and I'm so like, oh my gosh, I learned a new thing. And I think giving ourselves credit for what we've achieved and what we've done and what we've got through, that's amazing.
It actually is, and it's the community together and the experts with the resources continually working hard, like yourself and all of those associated with the support services to help people. I think so we are in the marathon, and this is the time when people have to dig deep to really continue. So when your resources and your energy levels are really low, go back to self-care, right?
You got it. Start at the beginning. Right? Get some rest, make a schedule, practice those gratefulness techniques, learn something new, and talk to a good friend like Carol, right? Who's been there and understands and wants to hear about you and wants to hear about your day.
The important thing is to reach out, even by telephone. You know, people who say, oh, they don't want to hear. Yes, you need to call and at least hear another human voice, just to be connected, because being connected is critical.
Yes, it is. Yeah. It's the most important part. I have 10 people I text with every single day that I didn't do that with a year ago, and it's meant the world.
So basically, that's your strategy to reach out to them and them to reach back to you.
Yeah.
So that's your mental health strategy, is it?
It sure is. I'm a chatty Jackie. I need to talk.
Jackie, I want to thank you for being on the program, and I hope that you will come back and give us additional strategies, and also to celebrate when we move beyond this. Thank you for being here today.
Thank you, you guys, for all you do.
Thank you. And thank you to our viewing audience for joining us today. Please join us again to learn more about services, programs, and resources available to you and to your family. Take care and stay safe. Thank you.